What's up, everybody? Welcome back to another episode of the SAFFY and You show. So unfortunately, Saffron cannot join me today, so I got Jade to join me.
Hi guys!
Yeah, so today it's gonna be a bit different. For the month of Movember, we're actually gonna not talk about growing facial hair. So today we're gonna meet some professionals to actually talk about erectile dysfunction.
Wait, Movember?
Yeah, for the month of Movember, you know.
I thought it's No Nut November.
I
Yeah,
don't know, I never heard of that though.
it's a No Nut November, so basically November you're not supposed to jerk off. I've never heard Movember.
Movember is you don't shave.
For what?
From just like that, it's like a man thing.
So you don't shave and you don't masturbate in November?
The masturbate I never heard before. But okay.
Okay, never mind.
Yeah, so today we're gonna talk about erectile dysfunction, in which I am very new to. As I know a bit about it, but
Yeah, sure. See, you want me to tell you a joke? I actually have a joke.
Wow, what's the joke? Okay, say the joke.
I don't know if I can say it. Okay.
Say it, just say it.
So once I played at a party for a bunch of guys with erectile dysfunction.
Huh?
Yeah.
What do you mean?
I DJ'd for a party
Uh-huh.
and it was for guys with erectile dysfunction.
Why specifically that?
I don't know, but the party was a flop and no one came.
Yeah, I got it. Okay, so we got Dr. Shravan, who is the CEO of Speedoc, and his co-founder Serene. And today they're gonna tell us more about erectile dysfunction.
And sexual health in general. I have
Correct.
some questions.
Yeah, okay. I also have a lot of questions, but
Why
let's
do you
begin.
have so many questions?
I never spoke about this before.
Okay.
It was never an issue for me yet. I don't know whether next time I have it, but if I do, then today I'm gonna learn a lot about
It's
it.
okay,
lah.
we're here
Yeah.
to answer questions.
Perfect.
No judgment.
Yes.
Okay, but let's
Thanks
begin with-
again for
yeah.
having us.
No
We're
worries.
very happy to share this knowledge, and I hope it helps all the people watching and listening to this as well.
Let's begin with like what is erectile dysfunction first. I mean, I know.
I mean, it's quite obvious, right? What?
So actually, erectile dysfunction is one of the sexual dysfunctions in males that they can have. There are a
Okay.
few different components to it. So anytime you have difficulty acquiring or maintaining an erection during sexual intercourse, that's called erectile dysfunction.
Okay.
But more than that, even things like having a decreased sex drive or libido, things like ejaculation problems, like whether you're premature or delayed or cannot have ejaculation, all these come under the umbrella of sexual dysfunction.
So
Okay.
actually now I have a question, right? So when does it become from like it's just you're just having difficulty having sex versus when does it veer into having erectile dysfunction?
So usually there's no fixed definition, but whenever people are having recurrent problems in acquiring or maintaining erections, and to the point where it's even causing issues with their partner, that's when they would come to seek help, and we would term it as erectile
So you
dysfunction.
use the word maintain,
Yes.
right? So usually erectile dysfunction is like they get up first and then
Uh-huh.
they cannot maintain, or they just can't get it up, or is it both?
Both. So both
Okay.
can be classified. So whether you are not able to get it up, as you termed it, or even you get it up, but then within a minute or so, you lose the erection and cannot have intercourse anymore.
What if you're like a stallion 9 times out of 10 and you're like super like going at it, but one day you drink like 2 beers, 3 beers, and then suddenly you can't get it up? Is that still
No.
right?
So that would not be classified
So
as
whiskey
erectile
dick is
dysfunction.
not.
Whiskey
Hey,
dick?
I never
because
heard of
that's what I
that.
thought
I
it
really
was.
never heard of that.
Yeah.
No, there is a term like that. I've definitely heard that.
In medical school.
Not in medical school, but yeah, that's more colloquial way
Yeah.
of saying it. But for erectile dysfunction to diagnose as that, it needs to be recurrent and even without any influence or
Got it.
any of these
Okay.
stimulants or anything else that you take.
So from what I've heard, right, there's quite a big population now where they said that like because they keep watching porn from like a very young age and then they get very used to it and then they can't make it like stand in front of their partner or whatever. Is this a real thing now?
There have been a few studies done, and it has actually shown mixed results. So we cannot say for sure that watching porn can cause erectile dysfunction.
Okay.
But anecdotally, yes, we have heard from.
Wait, what? Any what?
Anecdotally, like
people
just
tell you story,
people
you know?
tell you story.
Okay. I never go NUS, guys. So sorry.
It's just people sharing I watch a lot of porn, then cannot have an erection.
So that's an issue.
There is, so that's why the few stories people do mention that, and usually it happens because people get desensitized to actually being able to have intercourse with their partner, to the point where they're always thinking about what they watch in porn, and sometimes it's not realistic. You can like have multiple tabs, multiple windows, multiple females or males, and that doesn't translate into reality. So because of that, they sometimes have difficulty being sensitized to
That
it.
is so
Giggling.
weird. No, that is so weird. Because like if you watch porn and then you want it to happen, right? But then when it happens, you can't get it up because you don't see what you see on the screen as
Exactly.
I guess it's one cause, but I know that age is definitely a cause because
Mm-hmm.
from my experience, sometimes as the guy gets older, they have like a decrease in libido. So is there anything that they can do about it?
Definitely, and that's where if it is becoming a problem, it is important to speak to a doctor. There are actually multiple reasons why this happens, or erectile dysfunction, or any sexual dysfunction.
Yeah.
So we don't think of it, when it happens, but what is actually happening in the body? It's a combination of your nervous system. It's a combination of your hormonal system. It's a combination of your vascular system, which means blood supply,
okay.
and your psychological. So all these four combine for you to be able to engage in sexual activity.
Which plays like the biggest factor? Like psychological.
I think blood supply, right?
I wouldn't
Is
know.
it not a blood supply?
Like you will need to
issue?
think
Oh.
like okay, blood, and then like
Okay. Is that what you think of?
That's quite scary if that's what you think of.
like if you want to get horny, like you either
blood.
Get the
yeah,
blood.
as in like you just close your eyes like okay,
So you can't say anyone is more important. You need a combination of all of those to actually have a sexual drive and sexual performance.
Okay.
So when you're trying to find out as age grows, you're trying to find out which of these could be affected. So many of the times we do see vascular or blood supply being very common problem for people, and even things like smoking, drinking alcohol, having diabetes, high blood pressure, cholesterol, all these things can decrease blood supply, which is one of the main reasons why as you age, you're not able to have erection or
what's like the common age that it starts?
usually it's seen above men more than 40 years of age. That's when the decrease in sexual drive and activity starts kicking into place.
Okay.
But anybody who has diabetes at a younger age is also prone or has a risk of having that.
Apart from porn addiction, right? What else that goes into like everyday life that can cause like erectile dysfunction?
Yeah, that's where smoking and drinking
Okay.
regular alcohol, all these can cause
Like regular once a week is fine, right?
once a week of alcohol or
Yeah,
smoking.
alcohol. If it's once a week of smoking, I'd rather not smoke.
True. So yes, I mean, it shouldn't affect that much, but usually people who drink every day, they can have a decrease in sexual function.
Why do you? At Risa.
No, I didn't know this.
Yeah.
But it has to be like hardcore drinking, like it's not like one beer a day.
Usually they say if you drink more than 3 drinks a day, that is a risk. So
Of
would suggest.
I feel like you have bigger problems if you're drinking more than 3 a day.
I
That's,
guess
Then
that's
erectile
also
dysfunction,
true.
so-
But if you're drunk every day, you're probably horny.
But then that will add to your problems, like I think it's a vicious cycle, right?
yeah.
Yes.
I mean, you should think about your kidneys more than your cock.
Liver.
Correct, exactly.
In your practice, do you feel like a lot of patients come to you for this issue, like sexual?
As part of primary care, yes. We occasionally do come across patients with any kind of sexual health issues, not just the sexual dysfunction, but even things like contraception or emergency contraception. So yeah, we see a wide variety of sexual
I
health
think if you're talking about like
cases.
our patients, I think generally the girls or the females are more willing to talk about their sexual problems. You know, males just don't want to talk about it, or you know they
It's
think
probably
that
an ego problem
oh,
lah.
they think that like you
Yeah.
know the problem is not with them, the girl not hot enough, girlfriend never make
Yeah,
them
so like,
excited.
at how many times and then I should be worried already? You know, like, so for example, like, first time I get cannot stand, second time I can stand. So what if it's like on off, on off, on off?
Yeah, so that's a very good factor for doctors to ask to understand what the cause is. So oftentimes when you do see a doctor, we will ask, oh, is it from the first time you were having this issue, or last time able to have it, no problem, but now slowly developing a problem, or is it like suddenly one day and having problem from there? So all of these things help us to figure out what could the cause be.
Okay.
So
And how often you have sex also lah.
yes. So
Okay.
if, for example, you say, hey, with this partner, I have no problem. But this partner, every time...
no.
Wait, you tell the doctor that? What the fuck? Doctor will like, okay, show me a picture. It's like, okay, this one is the problem.
Nothing wrong with you, sir.
Then other questions we ask is if you get nocturnal or morning erections, because that's a normal body's way of reacting. Whenever males at least have REM sleep, which is the deep sleep,
Uh-huh.
we do get at least erections 3 to 4 times a day. Of course, this decreases with age. Nothing like that teenager when you have it the most. But this is also one of the things, if you have more of a physical problem, even this starts getting affected.
That's an interesting thing. So, why do males have like random erections throughout the day, even though like you're not thinking of anything?
Yeah, so non-sexual erections is a normal thing to have, and it's a healthy thing to have.
Oh, okay.
And during REM sleep, there is some fluctuations in hormones which can cause these erections to take place.
Is there any like home remedies?
So that's where we look at all these different risk factors which can cause it, right? Even things like obesity, when people are overweight, doing things like exercising more, losing weight, stopping smoking, all these have shown to have an increased benefit on sexual function.
Okay.
So I would always suggest, like, even when especially young people come, they should try things like that, especially if they're overweight or anything, or they smoke or drink too much alcohol. We would always recommend do those first. Exercise has shown to improve erectile dysfunction in quite a few
But
studies.
it's in the long run, right? It's not like
It's
I
not
can't
quick
get it
fix.
up, let me go for a run.
Yes.
Yeah.
So usually we would recommend, start running, exercising for a
Yeah.
week or so, and then try get adequate sleep. Make sure you're not stressed. Even things like a bit of mood disorders like depression and performance anxiety can cause it. So all these we try and address so that people can have.
What about like food? Is there anything that is it clams or is it like cockles that has aphrodisiac?
Oysters.
Yeah, oysters. Yes.
Oysters, and that's a very commonly told story that we should eat, but there have been no as such studies done to show that it increases
Libido.
sexual
Okay.
performance or libido. But it's more like, if it works for you, why not?
I'm going for
I
oysters.
heard it's like an aphrodisiac because of the way it looks.
Yeah, that's
but
what
not
I
because
thought
of
also.
the actual
I
effect.
thought it was the way it tasted.
But apparently chocolate can be a aphrodisiac because of the endorphins that you get when you like happy sugar rush.
Have you probably like have consulted patients about this?
About sexual dysfunction?
Yeah.
Oh, definitely.
Okay, so bring us through it. Like how does it go?
So a lot of the times they would come saying, they're having issues sexually. They do tell us whether it's erectile dysfunction or whether, they're unable to ejaculate or even decreased sex drive. And that's what leads us to doing a bit of a history taking, which is where I say start suddenly or, over time. Are you still able to have erections while you're masturbating? Do you get morning or nocturnal erections? Do you have any conditions like diabetes, high blood pressure? Then we look at whether they're overweight or not as well. Ask them about their exercising. ask them if they take any medicine which can also cause sexual dysfunction. Things like antidepressants can affect your sexual function as well. So we do ask for all these, whether they take any such medicines. Some heart medicines, blood pressure medicines can cause it too. Then we do move to examination. In examination, we check for the pulses near the groin to make sure there's adequate blood supply.
How does that work?
We look for
Like you put like the ECG.
no, just a hand is enough to check the femoral
Oh,
artery
shit!
Pulse. It's femoral artery. It's
it's here, it's here. Okay,
Yeah,
okay.
near the thigh.
What do you think?
Like maybe on top.
To see if it's hard, right? Oh.
Nah, there's like suddenly the doctor touch like, hey!
Hey, yeah, don't
laugh!
laugh.
Also, your problem is that you're not attracted to maybe it's
Yeah, maybe it's
attracted
like,
to the other,
yeah,
the
correct. You
gender.
swing that way, then the doctor touch like, hey!
Your cup of
Oh,
tea
yeah.
is
Okay, so
different.
sorry.
So if we're checking the pulse, we do say, okay, we'll be checking the pulse near your thigh. Then even during an actual genital exam, we make sure there's a chaperone and anybody available, and we look for any things like even lumps or growths near the testicles. We do check the prostate as well.
How do you check the prostate?
Yes, the prostate is checked with the digital rectal exam, which is
Digital rectal.
Digital means finger digits,
digital
right?
is finger,
So,
finger. So
Okay.
we do need to insert a finger in the rectum.
Can we
and
choose
then-
which?
The small one, please.
Yeah, it's like, see your hand first, doctor.
Usually we choose the index finger because that gives us the most sensation. So if there's any like growth or it's a big prostate, we are able to feel it.
Okay.
Based on all these findings, do we kind of figure out what the problem could be, and then depending on the problem, we try and address it.
Okay. Do all problems have medications, or like do you tell some patients like, hey, you need to do this at home? Like you tell them go and work out, or do you like give them medicine all the time?
Usually for young people, we would recommend trying some of those remedies first, like exercising or improvement in their lifestyle, to try and see if it helps. We do give medicines, and of course, which I'm guessing you're getting to, the most popular medicines that we've heard of is Viagra and Cialis. These are all phosphodiesterase inhibitors. That's the name of the class of medicine, and it helps to maintain and increase the blood supply to the genitals.
Okay.
And for these, when you take these medicines, it does help to at least get erections and maintain for easier, because it maintains the phosphodiesterase, which helps to increase your nitric oxide levels, and that expands the arteries, so there's enough blood flow. Usually for Viagra, it lasts about 4 hours, and that doesn't mean the erection lasts for 4 hours. That means the effect of you being able to get easier erections will be 4 hours.
So you have to rush everything within that 4 hours, like that sense.
You should ideally take it 1 hour before you're about to commence sexual activity.
so you only have 3 hours left.
No.
Oh, alright, right. That's what I was thinking.
No, not quite. So say you decide to engage in sexual activity, you should take it 1 hour before you are thinking of engaging.
Does it make you last longer though?
Yes, I heard it does though.
It can make you last longer. It does.
Wow.
Yeah, because you have more blood flow, right? So the blood flow is maintained for longer as well. So you can last longer.
Okay.
It does go back again. If it's lasting longer than 4 to 6 hours, then please seek.
I heard
Yeah,
it
yeah.
feels better as well. But I guess maybe that's an anecdotal thing. But I heard with Cialis, it does feel good.
People have said that it does improve sensations. Yes.
Ooh, I want to try it.
No, cannot try. You don't have the problem.
I have, doctor.
So I have a question. So Jade, just now you said that this Cialis actually increases or helps with sensation. So does this also help with the other problems like premature ejaculation? Because from what I heard is you want to decrease sensation for premature ejaculation, right?
Yeah, it does do it. Although for premature ejaculation, we recommend other things. Even small things like wearing contraception can decrease the sensation and help you last longer.
Wait, what's wrong with like pre-ejaculation?
It's
Really? What's wrong with it?
Maybe
I know you can
more
get a
for
girl
the
pregnant.
partner that
Yeah,
it
okay,
could be
okay.
more of an issue rather than
But how do you know if you have an issue with pre-ejaculation?
if your partner is like
Because you don't feel
complaining
it.
all the time, I guess.
yeah. And one of the
Oh
things.
wait. What do you think premature? I thought I think I'm mistaken. I thought premature ejaculation was when like you come too fast.
That's
And-
my understanding.
Yes.
Oh,
You're thinking of like pre-cum. right?
yeah, pre-cum. I thought.
No,
it
Oh,
was-
like
so
where you're
it,
having sex
it
and
means
you wear a condom.
you come too fast.
Okay.
And not only that, it can also be conditions where you don't really have a full erection or even engage in sexual activity, but you already come.
Okay.
So then it's not satisfying for either of the.
You never had sex
partners.
with a virgin before. a guy who's a virgin.
No, but he
It's
said
like-
before you have an erection, you already.
No, like before
Yeah.
it even goes in, or like when you put on the condom, then the guy comes already.
Yeah.
Last question, actually.
Mm.
So, what if medication don't work on someone?
So that's where you again have to go back to the drawing board and find out what the issue is. So if
Is
you're
there a
taking
case
the-
like Viagra or like syphilis?
Cialis.
Cialis.
syphilis is a
Syphilis is not-
sexually transmitted infection.
Really not medicine.
Cialis, yeah.
Okay, Cialis.
Yeah. Cialis. Yeah.
Cialis,
Yes.
right. So if Viagra or Cialis don't work, and then what's next?
So again, it goes back to finding out what the cause of the issue is. So
Social escorts. It's next. It's like here's the
There's-
number.
No,
Call this
so
number.
there's actually
Also
also a
household.
treatment called penile injections, self-injections, where you can inject
Blood
yourself.
or inject the medicine
Inject the
straight.
medicine straight to the penile gland, and that is actually not even, it doesn't even need to be aroused sexually. So immediately when you inject, you get an erection.
I heard
Where
porn
do you-
stars use that. Like
Where-
that's what they do to get.
Where do you inject it from?
You inject it directly in the penis,
Like in the hole.
not in the hole.
Why is everything to the
That's the only
Like the
access,
hole and
babe.
take blood also from the
No,
hole.
injection is got needle, right?
Yeah. So maybe like you
anywhere.
put inside. So when you
Yeah, so
like
that's actually the next step that we do if the medicine doesn't work. And but the take up is not very high, as you can imagine. It is a bit uncomfortable, and
Yeah.
not many men are comfortable.
How
putting
about your
So-
girlfriend do for you? Hey, you like
yeah. So
or not?
you inject anywhere around.
No, so first few times the doctor will show you how to do it.
Yeah, so how?
Please
Do you know
it
how?
carefully. Yes, so you have to. It's a
I'm
whole
very
process.
curious. So oh my god.
So you need to clean, make sure it's sterile, and then only you.
So
inject
actually, would you
in
rather
landmarks.
inject yourself or would you rather your girlfriend inject you for you?
I'll have both.
Ah.
Oh, I'd rather inject my girlfriend. My girlfriend inject for me.
Your
Yeah.
girlfriend
Girl has smaller heads,
Ah.
so they are more careful. Yeah. Plus, if you're horny and you're a guy, you probably like, ooh, like you know.
But you're not horny.
No, yeah,
You
but
can't get it
you
out.
inject it when you don't have an erection.
Yeah,
But
yeah,
the
yeah.
medicine does help to get you an erection, and that's a bit different from Cialis or Viagra, where you immediately get an erection, and it's not like you need to engage in physical activity or sexual activity. Then, if that also doesn't work, there is a penile prosthesis that can be considered. That we don't do very often, but it is a consideration. There, they essentially put a pump, implant a pump, and that pump helps to
I've heard about this.
release fluid in the penis.
You
which
press a
helps you get
button and
erection.
then whoop.
They
Yeah.
inject a pump.
No, they
No,
put a pump
it's an
into you.
implant.
It's an implant.
Implant.
Yeah, it's very common with like FTM.
Yeah.
FTM when they're getting like a prosthetic and they have like
So you
Yeah. It's inside of you.
Yeah.
And then
And
you
there's
press
a-
like your
you-
ball area.
Yeah.
You, like,
and then you press a
like
button.
yeah, like a balloon.
You press the button and whoop.
wow.
Yeah. Why? Mind blown, right?
Yeah, I'm so mind blown.
No
I just
more
thought like,
problems.
okay, if medication don't work for you and then you're done, you know? Like,
Yeah. There are these options, and there's also
Oh, there's more.
vacuum. Yeah.
okay,
So
okay.
Vacuum?
What?
Like there's a vacuum suction.
Oh.
Also, you suck blood into it.
No, like a pussy pump but for your penis.
Exactly.
Yeah,
it's
so
a
you-
pump.
I still that
Oh,
doesn't
it's
make
oh,
sense.
this is like a
Vacuum
sex toy,
suction.
right? Like there's a
It's-
sex.
Yeah, you can get it as a sex
Interesting.
toy. Yeah.
Wow. So, do you advise people to get that sex toy first? I feel like that's the lowest barrier of entry.
Yeah, but the problem is you also don't want to get desensitized to the point where you need it every time. So usually we would suggest trying without it first.
So, because sometimes, like, if it's a psychological problem, then when you take like Viagra, you feel like that confidence, and then it sort of goes away.
Mm.
It lasts quite a while. So we've come to the end of this episode. If you've never heard about Speedoc, it's basically an app. It's a 24-hour doctor healthcare service where you can call a doctor through a teleconsult, or you can get a doctor to come to your home and receive your medication between 1 to 2 hours. So no more waiting times, no more, I don't know.
Yeah,
No more waiting in
No
line.
more
Yeah,
leaving
no
your
more waiting in
house.
line.
No more leaving your
Yeah,
house.
especially now with COVID,
Yeah.
it's great that you can see a doctor without having to risk a trip to the doctors.
Correct. And erectile dysfunction is something that they can help you with.
Yeah, if you're embarrassed about talking to your family physician, you can always, do a consult. It's a little bit less personal. You don't feel so embarrassed.
Yeah. And so we would like to thank the both of them for coming here to tell us about all these types of things. I hope you guys also learned something about it. And tell your friends about it.
Thank
Yeah.
you for having us.
Thank you so much for
No
having
worries,
us,
yeah, actually-
and hope it was educational and enlightening both for you as well
It was.
as
For
your
our audience.
listeners.
Yeah.
And if you do have any questions, always feel free to reach out and we will try and help out or do a video consultation to
Yeah.
help the best way possible.
Yeah. Okay, if not, we'll see you guys in the next episode. Bye.
Bye.